It's Eddie again. I'm in trouble again. The thing I'm on here about now is a company called Patient Claim Line. They claim to help you if you had malpractice by the medical profession. And they are useless. Don't waste your time with them, go somewhere else. Because Patient Claim Line, I cannot get them to make any sense of what I'm saying. I've told them to watch my videos on here and they'll see what it's all about. They know I'm being persecuted by the doctors because I'm bloody well kicking up a fuss about it. I had the same doctor for 40 years and I've had this condition for 60 years. And this doctor retired in 2012. I was given a course of steroids by a specialist on the immune system telling me what the trouble was. Now, it started off as a little itch on the feet and legs and soreness inside my mouth. And when I spoke to the specialist about it, he said, well, a course of steroids will do it, but you have to have 30 milligrams a day for 4 weeks, reducing by 5 milligrams every week thereafter. Well, these new doctors that's taken over from the one that's retired, I've had 3 courses and not one of them has been done correctly. They've reduced me by 5 after the first week, and in one case they reduced me from 5 down to 3 in 1 week. And each time it makes things worse. What they don't know, and what this doctor that called today doesn't know, that's a Dr. Buxton, by the way. That's another different one calling on me. He didn't know that you could get this here so-called itch internally. He thought it was me, that I wanted the steroids just for the itch on my blooming leg. Well, it's not. It's my mouth, my throat, my gullet, my stomach, my colon, and my anus. It's all the way through the lot. That's why I have terrific pain going to the toilet, and now I'm having pain passing water as well. And Patient Claim Line, I've got a clue what I'm talking about. They keep asking me stupid questions that I have no idea what they're talking about. The doctors messed around with my medication. They changed the specialist, and every time they've done that, it screwed me up. And I've discovered that it wasn't the prednisolone, the steroids causing it, it was Molexicum. And I stopped taking that. And they come here today, well, you got it wrong. We don't want you on these steroids. I said, well, if you don't have me on them, you're going to have trouble, because when if I don't take them, I get so much pain, I'm going to keep ringing 999 and pressing my bloody button. I was stuck on the toilet again today. 3 days in a row, I've been in agony. And they don't believe it. They think I'm having it all on. Well, when it all comes out, by God, there's some doctor's going to be struck off. They think they're gods. They're not. They cannot know more than me about it. 60 years experience. It took 5 years for the doctors to diagnose what it was. And even then they didn't know why it was. They called it lichen planus because it was on the legs. A bit like psoriasis and that sort of thing. But it's not. It's autoimmune. And that's what this specialist explained it all to me. Now the doctor's trying to tell me, oh, it's too high a dose, 30 milligrams a day. Well, in actual fact, it's only half the maximum dose. You can be given up to 60 milligrams a day. They don't know me, you see. I read things, I learn. And when I read and learn things, I remember them. And that's how I caught the doctor out this morning, when he was saying, oh, well, just for itchy skin. And I said to him, itchy skin, that's got nothing to do with it. It's the internal because they give you cream for the skin, which is no problem at all. But that's no good for your stomach and your bowels and your mouth, because it specifically states for external use only on the tube. It doesn't cure it, but it does relieve the itching. But that's not the worst of it. The worst of it is that when I take these steroids, they don't just cure the internal pain and that, they also improve my arthritis. I get less pain through arthritis. Now they're dragging me off it. I'm starting to get pain again, and that's why I get grumpy. And now they've sent me a letter saying that we don't like it because you're shouting. I'm shouting? I don't even know how loud I'm shouting anyway, because they've ruined my hearing by syringing my ears and giving me a virus. And it doesn't just affect the ears, it affects the nasal, it affects the eyesight. I get more results sticking my ear up to a shower at night to wash out the wax than their bloody syringing. And I never got an infection. I was 77 before I even went to the doctors about my hearing, and they said, oh, they're all waxed up. They told me to put olive oil in my ear for a week, and then to go to the surgery to have it syringed. I went down, it was syringed. It was marvellous, all my hearing was back perfect. Just one little snag. 1 week later, that's incubation period, the virus takes effect, and it gets worse and worse and worse. Now, I'm totally deaf in that ear, and this ear is starting to go. I keep that one going by washing it myself, using medicated shampoo and sticking my ear up to the shower, and it rinses it out, and I can tell that the hearing's getting better by the noise of the water. Anyway, that's that. Now, if you've got a problem like that, do not go to Patient Claim Line. They'll drive you mad. I've just been talking there, and I can't make head and tail of what they're saying. Then I find out I'm not talking to a lawyer, I'm talking to a bloody receptionist. And it sounds like she's knew less than I know about anything. Because I talked to the specialist, and he explained to me what happened and why it happens. How the first 17 years of your life, your immune system is building up, and after you're 50 it starts deteriorating. Christ, I was hoping by now, being nearly 80, it would have deteriorated enough for it not to affect me anymore. But thanks to the bloody doctors messing around, it's actually getting worse. And I can't get Patient Claim Line to do anything. So if they want me to say how wonderful Patient Claim are, they better get and do something. Otherwise I'll be going elsewhere. I've just seen another advert for health matters. What more do they want to know? They diagnosed me as being diabetic when I'm not. They gave me metformin for diabetes. It made me ill. I went into hypoglycemic shock. And then they took me off that and tried me on glycoside. And that didn't make me worse, so I kept taking it. But now, I stopped taking every bloody thing they give me. The only thing I'm taking now is painkillers. Because they're now trying to say, oh, the diabetes got better because of the treatment I had. I haven't had any treatment for 6 months for diabetes, and I've had no treatment for hypertension. That's high blood pressure to you, either. So there you are. Now, if anybody gets this and can pass it on to somebody of importance, my next move is the Ombudsman. So anybody can help me. This is sent to the Labour Party. Go on, have a go at the Tories about it, because they're to blame for it all. The poor doctors have got no money. They haven't got the time to do the job properly because there's not enough doctors. And if you go on, if they come up with my records, they refuse to give me the records. That's what Patient Claim want. They want the records. They want the dates. How the hell's can a man of 80 remember the dates of something that happened 2 years ago? I know the name of the hospital where I was treated. I know the name of the doctor's surgery. I know what they did. God, it isn't like it's just the one thing. We're now on the third and fourth things that they're pissing around. They're now trying to say I'm insane. And they're trying to have me put away. Of course, they can't do that without getting a court order. And of course, that'll expose everything. Anyway, that's all I got to say. I'm in too much pain to stay here any longer. And I hope the lady from Patient Claim Line has visited my website and sees this, and perhaps something different will happen. There you are. Goodbye.